Dear doctors, I hope your preparation for EDIC Part 1 is going on well. Today I am going to discuss questions related to ethical aspect of EDIC Part 1.
Question 1. A 68-year-old man with advanced COPD and severe sepsis is ventilated in ICU. Despite maximal therapy, he is deteriorating. He had expressed verbally to his family in the past that he would not want prolonged life support. There is no written advance directive. The family insists on everything possible. According to ethical principles, what should guide your next step? Continue full treatment as per family request. B. Respect patient's previously expressed wishes and consider withdrawal of life-sustaining treatment. C. Seek hospital legal counsel immediately. D. Ask the family to sign a Do Not Resuscitate (DNR) form. Continue maximal therapy until the ethics committee meets. Correct answer is B. Respect patient's previously expressed wishes and consider withdrawal of life-sustaining treatment. Explanation. The cornerstone of medical ethics is respect for patient autonomy. Even in the absence of a written directive, credible verbal expressions of wishes should guide care. The clinician should communicate with the family, explaining that continuing futile therapy would not respect the patient's autonomy. Legal involvement is reserved for disputes, not the first step. Question 2. A 54-year-old unconscious patient requires emergency intubation for hypoxemic respiratory failure. No relatives are present, and no prior wishes are documented. Ethically, what is the most appropriate action? Delay intubation until relatives arrive for consent. B. Proceed with intubation under the principle of implied consent. C. Wait for ethics committee approval before intervention. E. Administer comfort measures only until consent is obtained. Start non-invasive ventilation and reassess later. Correct answer is B. Proceed with intubation under the principle of implied consent. Explanation. In emergencies, where delay may cause harm, the principle of implied consent applies. It is assumed that a reasonable person would consent to life-saving intervention. This balances beneficence and non-maleficence. Waiting for family or committee approval risks avoidable harm. Question 3. A 35-year-old ventilated patient with septic shock is enrolled in a randomized controlled trial, RCT, for a new drug. The patient's wife later learns about the trial and expresses anger that she wasn't asked before inclusion. What ethical principle was most likely breached? Beneficence. B. Autonomy. C. Justice. D. Non-maleficence. Confidentiality. Correct answer is B. Autonomy. Explanation. Research requires informed consent, ensuring autonomy. Emergency research sometimes allows deferred consent, but once feasible, relatives or legal representatives must be informed and consent obtained. Enrolling without disclosure when alternatives exist violates autonomy, even if beneficence is intended. Confidentiality in research includes obligations to protect information from unauthorized access, use, disclosure, modification, loss, or theft. Question 4. A 70-year-old woman with advanced dementia is admitted to ICU with septic shock. The team considers further escalation futile, but her son insists on continuing all interventions. What is the best approach? Unilaterally withdraw treatment as futile. B. Continue all treatment to respect family wishes. C. Arrange a structured family meeting, involve the multidisciplinary team, and explain prognosis. D. Seek a court order immediately. Transfer the patient to another ICU. Correct answer is C. Arrange a structured family meeting, involve the multidisciplinary team, and explain prognosis. Explanation. The principle of shared decision-making is crucial. Futility discussions require multidisciplinary input, intensivist, nurses, possibly palliative care, and empathetic communication. Abrupt withdrawal or legal escalation should be avoided unless resolution is impossible. Question 5. A 32-year-old man admitted after a suicide attempt confides to you that he intends to attempt suicide again after discharge but asks you not to tell anyone. What is the most ethically appropriate step? Maintain confidentiality and respect autonomy. B. Inform psychiatry and mental health team despite breaching confidentiality. C. Do nothing unless he repeats the attempt in hospital. D. Tell the family directly without professional involvement. Document the conversation but take no further action. Correct answer is B. Inform psychiatry and mental health team despite breaching confidentiality. Explanation. Confidentiality is a core ethical duty, but it is not absolute. When there is risk of serious harm to the patient or others, clinicians have a duty to protect life, beneficence, non-maleficence. Informing the mental health team ensures safety while minimizing unnecessary disclosure. Question 6. A 55-year-old Jehovah's Witness patient is admitted with massive upper GI bleeding. He is conscious and refuses blood transfusion, fully understanding the risks. The family begs you to transfuse regardless. What should you do? Respect the patient's wishes and withhold transfusion. B. Follow family requests since they are surrogates. C. Administer blood covertly in the patient's best interest. D. Seek immediate court approval to override decision. Ignore refusal since it contradicts medical standards. Correct answer is respect the patient's wishes and withhold transfusion. Explanation. Respect for autonomy means that a competent adult has the right to refuse treatment, even if refusal increases risk of death. The role of the physician is to ensure informed decision-making and document discussions. Family cannot override a competent patient's choice. Question 7. A 56-year-old man with metastatic pancreatic cancer is admitted to ICU with septic shock. He is currently awake and asks you directly, "Doctor, please be honest with me. Am I going to survive this?" His family had previously requested that you avoid discussing prognosis with him to keep his hope alive. What is the most ethically appropriate response? Respect the family's request and avoid discussing prognosis with the patient. B. Provide full disclosure using clear, compassionate language and address his concerns directly. C. Tell the patient only partial information to protect him from distress. E. Redirect the question and suggest he speak to his family instead. Delay the discussion until palliative care team is available. Correct answer is B. Provide full disclosure using clear, compassionate language and address his concerns directly. Explanation. Ethically, truth-telling and respect for autonomy mean that competent patients have the right to know about their condition if they ask directly. While family input is valuable, the physician's primary duty is to the patient. The correct approach is to answer honestly but with sensitivity, balancing truth with empathy and support. Avoiding or deferring the discussion undermines trust and autonomy. Question 8. A 48-year-old man in ICU for pneumonia received the wrong antibiotic due to a prescribing error. The error was identified after 6 hours, and no harm occurred. What is the most appropriate next step? Do not disclose, since no harm occurred. B. Document internally and move on without patient or family disclosure. C. Inform the patient or family honestly, explain what happened, corrective steps, and apologize. D. Wait until hospital risk management approves disclosure. Avoid discussion to maintain patient trust. Correct answer is C. Inform the patient or family honestly, explain what happened, corrective steps, and apologize. Explanation. Ethical principles and professional standards emphasize honesty, transparency, and trust. Even when no harm occurs, medical errors must be disclosed to patients or families with explanation and apology. This supports beneficence and preserves trust. Concealment undermines professional integrity. Question 9. During a pandemic surge, only one ICU bed is available. 2 patients present simultaneously. Patient A, 30 years old, previously healthy, severe ARDS. Patient B, 72 years old with metastatic cancer, septic shock. According to ethical principles of distributive justice, what should guide your decision? Admit patient B because age should not be a factor. B. Admit patient A based on greater likelihood of survival and long-term benefit. C. Randomly assign the bed to avoid bias. D. Admit both temporarily by sharing one bed space. Admit the older patient to respect seniority. Correct answer is B. Admit patient A based on greater likelihood of survival and long-term benefit. Explanation. ICU triage in scarcity uses justice, fair allocation, and utility, maximizing benefit. Patient A has higher survival potential and long-term prognosis, justifying prioritization. Age alone is not the criterion, rather prognosis and proportionality of benefit. Random or sentimental allocation ignores ethical frameworks. Question 10. A 62-year-old man with intracranial hemorrhage is ventilated. His family speaks little of the local language. A nurse suggests asking another bilingual patient's relative to interpret during a family meeting. What is the most ethically appropriate response? Proceed with the relative as interpreter since it is convenient. B. Use simple words and gestures to communicate directly without an interpreter. C. Delay the meeting until a professional medical interpreter is available. D. Share only minimal information to avoid miscommunication. Ask a bilingual junior doctor to briefly explain instead of a professional interpreter. Correct answer is C. Delay the meeting until a professional medical interpreter is available. Explanation. Communication in critical care must be accurate, confidential, and culturally sensitive. Using another patient's relative breaches confidentiality. Professional interpreters ensure fidelity, respect, and clarity. Convenience cannot override justice, respect, and professionalism.
Dear doctors, I believe these questions will be useful to you during your EDIC Part 1 exam. If you have any doubt or if you want to discuss any question or their answer, please write them in comment section where I will respond.